Good day. This is Brian Castle, physician executive for 50 plus years, and this is vlog number 2. And you see my friend Poppy here with me, who is going to help us talk about Healthcare 2020. Now, previously, we had discussed a little bit about where we were going to go. And today we're going to take it a step further. So I'm going to get out of the way and we'll focus on the slides. In part 1, we will discuss the impact of healthcare coverage, or lack of it. As I had mentioned previously, I was just retiring for the second or third time when that congressman from Idaho, going back to visit with his hometown constituents, came into a bit of a surprise. One of his constituents said, "You have just voted to take away our health care. We'll all die." To which the congressman said, "Nobody ever voted to take your health care away." And then he stopped and said, "No one ever died from lack of health care coverage." Well, you can imagine the crowd's reaction to that statement. Me, I had to come off the sidelines again and research the subject. And I'm going to present this to you. And I'm not going to use the hyperbole and the use of unsubstantiated data. Although I do have my opinions, my approach to Healthcare 2020 has been to research the facts using the logic of evidence-based medicine. I will present the facts based on that research. It's up to you to do your homework and determine which data is relevant to you as you face the difficult task ahead of deciding the future of Healthcare 2020. So with that, let's go on. And why is this important to you? As I had mentioned in the first vlog, our current healthcare model is broken. It is driven by profit, which impacts your cost. We discussed previously the four-party, for-profit healthcare model that we currently have in this country and why you need to become an informed consumer of healthcare. And just in case you didn't remember, here it is. By way of a reminder, here are the parties. There's one party, the provider, who provides the services. They each have their own master list of charges for those different services. The charges are different from provider to provider. Then there is the second party. That's us, the second party. Here's the providers. Poppy's giving them the evil eye. But here we are. And we are the ones who are sort of out of the loop. And then there's the third party. And these are the payers. And we had talked last time about who pays for health care and what the percentages of our population were. And then remember, in the four-party system, there is that fourth party, which is the decision makers. And it's how they approach health care, our for-profit health care insurance model, that determines what happens to you. I'd like you to remember that there's 31 million folks who currently are without health care coverage. And added to that are an additional 31 million who are underinsured, which means they don't get their health care when they should. And why is that? Because at the end of the day, it's cost. And cost becomes the money out of your pocket. Now, if this is the benefit coverage circle, where we want to be so we get health care coverage, let's look and see what happens in order to get there. Well, first of all, you have to pay a premium. And sometimes there are some tax credits based on income which will help you. But that lets you get near the door, because then you've got to pay your deductible, whatever it is it's going to cost you before you get coverage. And then there might be an in-network piece which says you have to go to a certain group of doctors, and woe to you if you don't. Okay, let's say you paid your premium, you met your deductible, you're going to go see the doc that's in network, and you've got benefit coverage, right? Maybe. That is determined by your benefit coverage. because there may be things that aren't a covered benefit. And if that's the result, that's money out of your pocket. So, in order to get into the circle, you had to meet the deductible and in-network, which could be money out of your pocket. And then you got in and you got benefit coverage, but not all things are covered. Okay, well, let's say it is a covered benefit. You're in, right? No. Then there's a thing called medical necessity. That is it medically appropriate for the condition that you have? And if it's not, it might be considered experimental. And guess what? More money out of your pocket. Well, now let's see. We've met our deductible. We've taken care of the network issue. It was a covered benefit. And oh yeah, it was medically necessary. Okay, great. Now we go see the doc and get covered, right? Not right away. Because before you see the doc, you may have to pay a copay at the time and place of service. More money out of pocket. Okay, you've done the whole thing. You've seen the doctor. You've gotten the treatment. The doctor sends in his bill, and then you get this thing called an EOB, which is an explanation of benefits. Because what happens is the provider, remember the provider can bill at many different levels for many different services or even for the same service, and then your payer decides who they're going to pay and how much. So after all that's worked out, then, oh Poppy, it's not your time to talk yet. Anyway, Poppy, hush. Okay. So anyway, then you get this EOB, and with it you may have another possible bill. It'll say you might be eligible or you may be susceptible for this payment, which is called a coinsurance, and guess what? That's more money out of pocket. So at the end of the day, cost becomes the money out of your pocket, and at the end of the day, it's that cost that leads to the problems with our for-profit healthcare insurance model. Now, even in generally good economic times, Americans face significant personal financial challenges. Foremost amongst these are healthcare costs, which we've talked about, and have been a consistent concern, but over time currently stand above all other concerns. As such, healthcare will likely continue to be a major focus in national elections, including the 2020 presidential election. Older Americans who are more likely to need health care and who are more likely to vote than younger Americans may pay special attention to what the candidates are saying for addressing health care costs. And as you can see, if we looked from 2017, 2018 to 2019, in an open-ended study that was done by the Gallup poll in May of 2019, at the end of the day, cost is important, and it has remained so pretty consistently since 2017. And this was the basis of the answers to these questions. And you can see it's healthcare costs, lack of money, low wages, college expenses, cost of owning, renting a home, taxes, too much debt. These questions were asked, and healthcare costs across the board has been the highest concern of people when it came to financial problems. And it also is continuing to be the most important financial problem by age. Again, if you look at all of the choices that were asked, and you look at the ages, 18 to 29, 30 to 49, 50 to 64, and 65 years old or greater, that healthcare cost continues to be a primary concern. Now, it's just in the younger population that there are other things that may be higher, like housing costs, lack of money, or low wages. But once you get beyond 30, healthcare cost continues to be the primary concern of Americans. And this continues even based on how much money your household makes. As you can see, here are the other questions that were asked. Here's healthcare costs. And here are the various financial conditions of the household. People who make under 40,000, 40 to 99,000, and 100,000 or more. And as you can see, healthcare costs consistently remain the most important financial problem, more so in the lowest income bracket. So, if we look at cost as where it ranks among other issues that are healthcare related, there are four things that people in America seem to be concerned about. One is losing their benefits of Medicare and Medicaid. And that indeed has a cost, because the federal government spent $684 billion with a B dollars in 2017 on Medicare. And on top of that, the proposed budget for 2019 has costs to Medicare that range up to $554 billion over the next 10 years. And if that sounds like it might impact you, the 55 million Americans who are over age 65 or living with disabilities, then it very well might. This is a 7.1% cut to Medicare by 2028. Now let's look at why that becomes an issue if you were losing your Medicare and Medicaid benefits, and why the changes that the present administration is including in their budget cuts. There's also been a proposed change for how they pay physicians under Medicare. Instead of allowing physicians to charge based on intensity of service and severity of illness, in other words, how sick you are and how much they have to do to make you better, there's only going to be one rate for new patients, one rate for established patients. And ultimately, if you are sick or a complicated patient, this might discourage your physician from accepting your Medicare coverage. The second thing the administration is looking at doing is making it easier for the Medicare Part D prescription drug plans to negotiate prices with manufacturers. No, not Medicare itself, only the Medicare Advantage plans, the United Healthcares, the Cignas, etc. This still does not allow Medicare to negotiate drug prices. And what does that mean for you? Well, officials want to require plans to pass on a portion of any drug maker's rebates that they get to their enrollees. If this results in reduced revenue for the plan, remember our for-profit healthcare insurance model, then this cost will be shifted to you. What will happen is you'll have higher premiums, higher deductibles, and shifting the drugs to higher cost tiers. What does that mean? Again, the impact of cost and healthcare coverage. The second issue that people have once you get away from cost is seeing the doctor of their choice, and that's called access. The third issue, healthcare costs, still there, still prevalent. And then people are concerned about the Affordable Care Act. Some hate it, some love it. So, that's where we are for our second vlog. Let me just go over what we went over. We talked about how cost has been the big issue. We've talked about how this has resulted in 31 million Americans who don't have coverage, an additional 31 million who don't get the health care they need because of cost. And we will continue this subject in the next few vlogs as we lead up to our coup de grace, which is, yes, people do die from lack of health care coverage. So, now for the commercial. Thank you for joining me today to discuss the future of healthcare. I am Brian Castle, MD, MPA, and I have been in healthcare for almost 50 years. I sort of feel like that insurance company, the one that says we know a thing or two because we've seen a thing or two. If you like what you see, go to my website, www.americanhealthcareintransition.com, subscribe so that you can automatically get this vlog and other information on Healthcare 2020. That's it for today. Talk to you again soon.